employees and save them thousands. We are so honored that you are online, whether you're watching us live or watching the replay. If you've snuck into our replay, we're glad you're with us as well. As you're arriving, as you're logging in, we'd love for you to say hi in the chat. So pop your head into the chat and let us know where you're calling in from. We always love to hear where people are calling in from. It's always fun, you know, people from across the country, good middle of the day time. So we should have lots of folks joining us today. So John, where are you based again? Where are you based?
Yeah, I'm in Indianapolis, which is in Indiana. If you are good with geography like me, middle of the United States, and been here, born and raised.
Nice, that's great. And Mark, where are you based again?
I am hailing today from Melbourne, Florida. Medi-Share's corporate headquarters on the Space Coast of Florida, and I was born and raised in Indiana, but right. I don't live there anymore.
Nice. This is the time of year everyone wants to live in Florida. You know, a good friend of mine lives in Sarasota, and he always bugs me at this time of year. I'm in Canada for folks that don't know. He always bugs me at this time of year about, you know, just weather and all that, but he never bugs me in like July. I never hear from him then. I never hear, you know, which I don't know why that is. So yeah, welcome friends. As you're logging in, we do have folks just piling in. We're glad that you're here. As you're arriving, make sure you say hi in the chat. We'd love for you to let us know that you're around and here. We're just so happy that you're with us. We're going to get started in just a minute, just to kind of outline what's going to happen today. We've got a killer conversation lined up, lots of good help, packed full with actionable information. So this will help you take some steps today. This is, you know, we know that there's people that are right this moment are feeling a certain amount of anxiety around these issues for their team, and we want to help you with that. But we also are going to have questions. And so at any point during today's conversation, you can drop the questions in the chat, and we will take care of those later in the conversation. So feel free to, you know, to do that. And today we were able to convince, if you were kind of watching our emails, we were able to convince two, not just one, but two experts on the call. Super excited to have Mark James with us from Medi-Share. You've heard us talk about Medi-Share. They're fantastic people. Love to, you know, and actually we did a podcast a couple of weeks ago with Mark, which I just love. And if you haven't listened to that, you should go back and listen to that, because he gave away his personal email address, which is crazy. And then we've got John Staub from our good friends at Remodel Health, which provides some really, you know, fascinating, innovative solutions for us in this space. And the two of them together are going to provide great solutions. So we've got a bunch of people on. Why don't we throw it over to you, John? I'm going to turn my camera off because I want people to see your beautiful faces. Why don't we throw it over to you, John, as you jump into today's conversation?
Yeah, thanks, Rich. I appreciate being here. And Mark, being with you makes me feel like we are assembling the Avengers. If you don't know what that means, go ahead and Google it. Grateful to serve again. Never thought I'd be considered an expert in this space, but I've worked really hard to get there. And to see the impact has been so much of a blessing. And so, Mark, do you see my screen, by the way? I want to make sure my screen share is working. You seen that? Great. You know, we've been talking about this concept all year. Me and Mark, we work alongside each other a lot. And that's kind of why we're on this educational webinar today. Is because we like this idea that you really can have it all when it comes to health benefits in a way that you probably never thought you could before, kind of like having your cake and eating it. You don't have to just make it, but you can have it too. And the real principle is health benefits you can really believe in at a cost that you really can afford. We're going to get into that because honestly, I know how that sounds. I've had health benefits, paid for health benefits, but hang on, it's going to be really a fun ride, especially if you get me and Mark into a room, a webinar. You're not going to be bored. So at the very least, you're going to learn something and smile along the way. Here is our agenda in case you're wanting to know what's ahead. I'm that kind of person. I do not like surprises. So if one of these things catches your eye, please make sure and hang on. Preventative coverage, we're going to kind of talk about that. That's, if you know, we'll talk more about that. But ultimately, we do want to answer your questions in your context. Learning anything is only as good as you can use it for yourself. And so please make sure, send in the chat. Rich is going to be feeding us some questions at the end. And that's really when myself and Mark come alive. Mark, I'd love to hear a little bit more about you. Obviously, I know, but I'd love to hear more from you and what has brought you here today. Obviously, Rich did a real nice, warm welcome, but share a little bit about yourself, and then I'll do kind of my intro before I get into the overview of the landscape.
Yeah, thanks, John. And it's great to be with everybody. Mark James here at Medi-Share. And really background-wise, the nickel tour is insurance, financial services, and sales, marketing, operations, et cetera. Healthcare in that journey along the way. And then I've been here at Medi-Share a couple years and just really excited about what I've learned about an innovative approach to healthcare that really is serving a lot of people across the country. So anxious to have the conversation we're having today, John.
Yeah, thanks, Mark. And my name is John Staub. I, as you will be able to tell how much and how excited I talk, I was a pastor for about 10 years, loved my time in ministry, and that is what has kind of brought me here today. Ultimately, you're also going to see I'm an unapologetic nerd. I love spreadsheets and data and math and innovative solutions. I've been into technology ever since I was real young, and I love how technology helps us to do new things better and faster, and in this case, even cheaper. And so that's kind of what has brought me to this space. I do want to share a little bit about my story. I want to inspire you a little bit, because without inspiration, the information we're about to share will be meaningless to you. So I grew up in as a missionary. That I was from 16 to 19. So my late teens, my whole family moved to the Amazon. And I was living there. I actually came down with dengue fever. Dengue fever can be deadly at times. I remember laying at my in my barely air-conditioned room, and knowing, even as an 18-year-old down there as a missionary, we did not have any sort of health benefit. Okay. Now, unfortunately, as a missionary, I knew that was very normal, but it was in those moments, kind of as this transition into manhood, I knew health benefits were important. And I was afraid what would happen if I needed healthcare all the way in the middle of nowhere. How would I get it? Fast forward to my very first full-time pastoral job. One of the reasons I was excited was not just because it was a full-time pastor job. It was because I had health benefits. And as I rewound the tapes and remembered how scared it felt to not have it, finally getting health benefits really brought me a peace of mind and helped me to do ministry better. Okay. I think a lot of us can resonate with that. We sometimes view health benefits just as obligatory. It's certainly needed, but we also know how much it costs, especially if you're in leadership. That is where I was in church, as in church leadership. And I remember getting called in to a meeting, an emergency budget meeting, where our health benefits had been doubled overnight. And obviously, all of us have experienced those times. My budget for the entire year, all my hopes and dreams have been slashed, not only in half, because my department needed to prioritize things differently. Nothing that I had planned for that next year happened in my ministry. And that was really hard. Fast forward all the way to my introduction with Remodel. I was in a parking lot, got chased down by the founder, one of the founders of Remodel. I did not want to talk to him, but he shared a lot of the details that me and Mark are about to share with you today. And not only that, but he first shared how much money they had saved just here in my home state of Indiana. And it was $1 million went back to churches. And at the time, Remodel was very small, but making a huge impact. And I said, I think I want to jump on board. It's just nerdy enough, and it's making a big enough impact. I like solving big problems. So I jumped all in, and that's what's led me here today. I love reading all the law updates and new strategies and better ways to care for the team. And so I represent all the pastors out there who need to be cared for, and I represent all the numbers for all you smart people that have to make tough decisions. So that's what's brought me here today. Really grateful to talk about particularly Medi-Share and Sharing Ministries, because it's just, as Remodel and Medi-Share came together several years ago, we have made huge waves in this space. So that's kind of our introduction right here. I want to ask you this question, though. Do you want more or less in your budget? I know it seems really silly, but if what Mark and I are about to share actually can make a difference, would you do something about it? And not wait until next open enrollment season, not wait until, something. Would you start doing something now? And here's the reason. We've actually seen just over these past 4 years, $68 million be put back into ministry, and those are with better benefits. Okay, so now I've given you the inspiration. Now we're gonna dive into some details. Mark, did I miss anything? We've done this before, but was that a good inspirational intro for us?
I'm inspired. Spot on.
Well, that's good. If I can inspire you again after you hearing this plenty with me. So, well, thanks, Mark. All right. So we'll take just a little breath, because what we're about to talk about is painful. We're all feeling this pain, but there is hope and light at the end of the tunnel. Okay, and in this season of hope in Christmas time, I want to make sure you know there's definitely hope for all of us. So the graph right here is not health benefits. This graph right here, I wanted to point out something. This is retirement benefits. And if you look at the dates at the bottom, it goes all the way back to the 1980s. Well, if you've done your research, or maybe even you have experienced it, there was something different than the current way we do retirement benefits today back in the 80s, and it was called pension plans. Okay. Pension plans were very quickly replaced by 401ks once that new model of retirement benefits came onto the scene. And I want you to notice that little dip right there. And if you're doing statistical analysis like I like to do, you're always looking for similarity in data modeling. Pay attention to that trajectory right there at the very top. And then look at what happened to pension plans. These group retirement benefits, they're gone. Okay. And 401ks, individual retirement benefits just took off. And it was, everyone was better for it. Let's talk about some of the problems, though. I'm switching away from retirement over to health benefits now. Okay. That's what you're here to learn about. Here are some of the state of the union, so to speak, as far as what we're looking at. Right now, the Department of the Bureau of Labor Statistics, is citing that 29.6% of total compensation on average goes to benefits. Okay. 30% of what you're paying an employee goes to benefits. That's a lot of money. It's the highest that it has been. Okay. Not only that, but you're not alone in wanting to rethink your benefits. 98% of all employers are reporting they're either researching or will make a change because of these costs. And then here's one of the most staggering statistics, is that we're looking at $15,500 on a national average, how much it costs to help employees with health benefits. Okay. That's painful. That's similar pain to what was happening with pension plans. And look at what's happening right here. Remember that data trend. When we're looking at statistical analysis, can we see mirroring between the two samples, not only just as far as the experience of those products themselves, but is the data supporting it? And they're absolutely. In fact, Mark, I just read today in an article, I didn't have time to update the slides. It's gotten even worse this year. They're projecting by the end of 2022 to see one of the worst years ever when it comes to group health benefits. We've been seeing it. Look how far back that this has been a problem. This is not a new problem. This is not an Affordable Care Act problem. This has been going on for decades now, and we're at the tipping point. We actually have been for a minute. Here are some of the other statistical points about this. Deductibles keep going up, and not only just going up, skyrocketing. If you look at that, that looks like a rocket, with the family premiums going up and not keeping up with inflation or the increase of pay. So much so that Harvard has noticed this. They've done some big studies at the beginning of 2020, and even at the kind of the end or at the end of 2020, the beginning of 2021. They were saying, hey, we need to rethink group plans. Maybe individuals need to just be given budgets to get onto their own individual health benefit. When Harvard says something, it's time to listen. Okay, that means it's been happening. They've invested resources to learn, especially when it's resonating with all of these other pieces of data out here. So let's talk about the difference between this right here. Managed individual. And this is the foundation. Once we get through the foundation, this is going to make a lot of sense. So hang in there. I'm almost done with the data side of things. Pension plans were a problem because they were one group plan for everybody. That sounds good, except one size never fits all when it comes to every single type of group that's out there. There's some groups that want something special for their group, but pension plans were kind of the same thing. There was not a lot of flexibility for the leader of that group to identify what everyone wanted in that organization. Okay, so just hang on to that. Then the other concept is just the cost. The cost kept going up and up and up, and you'd have new employees, but then you'd have old employees, and then you're having to manage everything and invest in wisely. It's a huge responsibility and a huge expense. And those big problems is why pension plans went away into something called 401ks. And the idea is, hey, let's get people onto individual plans. They don't need to be on a group plan. Let them have their own individual retirement benefit. Okay. Is this starting to sound similar to group benefits? It should, because it's really stressful to try to find a plan that works here and that checks all the boxes that you need as an organization. For example, a Christian product you can believe in, those sorts of things. But then also the costs going up and up and up and having this, and it's unsustainable, which is why over the past 10 years, something called managed individual health benefits has just taken off. It is the replacement of group health benefits. The way that 401ks replaced group, managed individual is replacing group health benefits. And the idea is the employer can offer a budget and help their people get onto individual plans. Okay. Again, that's that same exact parallel. You might be a little nervous because if you heard about this for the first time, I get it. No one wants to be the guinea pig of anything. You're not. Again, this has been around for going on, 10 years now, the overall model. But not only that, the Department of Labor is projecting in the next 3 to 5 years, 800,000 up to 1 million employers are going to move away from group plans into managed individuals. So if you're interested, you're right in the big group of everybody else that's making this transition. So here is now where we're going to connect the dots to Medi-Share. When you get into individual products and an individual health benefit, it unlocks specific things that can work for your organization, that can work for the individuals, and it can break things apart that if you have somebody with this, a particular need, an acute need, you don't have to lump everybody into that same exact benefit. You can actually make sure and take care of just one person, but then make sure you get a great benefit for everybody else. We're going to get into more of that. But look, sharing ministries are now available for your group, but now manage individual health benefit. Okay, so that's our introduction. Mark, thank you for listening. You're a great listener. I want to talk about this perhaps is the introduction for some people to Medi-Share, but this also might be a reintroduction. So Mark, you know what to do. You're the expert here when it comes to Medi-Share specifically, and I'd love to hear you take people all the way there.
Absolutely. John, thank you. Thank you so much. So Medi-Share, let's just rewind tape. We're going to start back at the beginning in 1993, where our late founder, John Reinhold, started in his garage. I like to say we have our garage story too. And he founded this thing that we've come to know and love called Medi-Share. And really modeling the early church that we see in Scripture in Acts, where Christians come together to support each other's burdens. And that really was the premise, and from which he leaped. And, if we fast forward to the next slide, you see the other side of the story. And that is that we're 700 plus employees serving over 400,000 members across the United States of America. So, starting in the garage and to where we're at today, we still have a lot of work to do. But I think the initial vision has been outsized of our late founder, and we're really proud of that. Vision and mission, so core and so important to who we are here at Medi-Share. And I will not take a lot of time, but there's a couple words I just want to pull the audience's attention to in both the vision and mission. And so under the vision, transforming society, I think all of us understand healthcare is broken in some way, shape, or form. And we believe here at Medi-Share that the biblical model of sharing is transformative. And so I think that's easy to understand, but hidden behind transforming society is what we're most excited about. And that is, how can we help be a point of light on the continuum to leading people to Jesus Christ? And so transforming society takes on that spiritual path as well for us. So it's a both and. And that really then drives us into our mission. And I draw your attention to Christ-centered community wellness. And just to put a little more meat on the bone, that's spiritual, physical, and mental. For example, about a year ago, we added virtual counseling as part of the Medi-Share product offering, so that 24/7, if someone has a need, they need to talk to someone. And, it's unfortunate that there's a lot of mental health going on in society, especially now post-COVID. But we are so thankful that we've already had an example where someone wanted to take their life and they used that service. And from what we know, we're able to steer them a different way. So Christ-centered community wellness, really, really important to us. And we'll touch on some of that a little later. If we go on from vision and mission and the garage to today, we like to say Medi-Share by the numbers, just to give people a look at who we are behind the scenes. And I'm not going to go into all the numbers here on the screen, but I'm going to talk about one that isn't on the slide and then one that is. So bookends. The first is not on the slide, and that is our revenue. One of the things that I find in conversations across the country about Medi-Share that people are often surprised by is our size. We're $750 million in revenue on an annual basis. And so, again, from the garage to today, we're moving the right direction, thanks to our members. The second stat that I would draw your attention to is in the bottom right-hand corner on the slide. And this isn't something that we publish in brochures. It isn't something you'll find in our website. But in smaller forums like this, we just like to share 80,000 hours of prayer that we spent with our members and care providers in the last fiscal year. And that's just taking the amount of time we invest, the number of phone calls and interactions we have where prayer is part of that conversation. And that really speaks to the heart of who Medi-Share is, and back to that vision of transforming society. That's one of many ways we try and lean into that. And so I just share that with the audience to give you a little behind the scenes look at who we are and sort of what's going on behind the curtain.
Yeah. Hey, Mark, I would love to share. You've heard this story from me before, but it's please, very important. It's very important to me because it was one of the moments where the light bulb went off for why what Medi-Share is doing matters so much in my own life and how it can and does impact so many other people. Being part of Remodel, I was able to get connected and become a Medi-Share member. And so in the midst of being the member, obviously you have, your emails and your bills and your calls and all this and those sorts of things. I was working one day, having a, kind of a stressful day. I think we can all empathize with stressful days. And I saw Medi-Share call me unsolicited, which worried me. I was like, oh, what did I do? Did I forget something? What is it? Answered the call, and all that they were calling for was just to pray for me. They're just saying, hey, just wanted to check in and make sure, is there anything we can pray for you about? I was like, well, yes, here are the things you can pray for me about. And then they prayed for me, and I said, I was kind of waiting for the gotcha. And like, well, hey, we hope you have a really great day and have a blessed day. We're grateful for you. And I was like, you didn't need anything else? And they said, no, this is just part of what we do. And that moment right there, I got it. And so anyway, Mark, I love sharing that story. Just as you mentioned, I love that you track it. I think it's important to know the scope and significance of what Medi-Share is doing. So thank you again for giving us the numbers. But I also want people to know this is a real thing impacting real people.
Yeah, no, I love that story. And I like it every time you share. And, we have members come into our leadership team meeting on a pretty regular basis every month, because we're nothing without our members. That's why we're here. That's who we serve. And it is amazing, some of the stories, John, like you just shared, and we've talked about this, just organically that comes out of our members' mouths about the community, the prayer, how members reach out to them. And so I will tell you, I come from the traditional side of the insurance business, and that was not present in years and years. And that doesn't mean it's wrong. We just think this is a lot better and the way God intended it.
I love it. Thanks, Mark.
Yeah, you bet. If we go on to the next slide, this slide is the Medi-Share difference, I believe. And for those of you who might be concerned right now, I am not going through every one of these items. If you would like to access this information, you can go to Medi-Share.com, and you'll see it below the fold, and it's there. You can study it. This is really our team coming together and saying, what makes us different generally to the other healthcare sharing ministries? And some of these are differences to the traditional health insurance marketplace as well. But I'm going to hit 4 really, really quick, because I think they're important enough to speak into. The first 2 go together. The first is direct bill management. I just want you to get rid of that term and just think, when I go to the doctor today and they send the bill to the provider and the provider pays the bill, that's direct bill management. That's what we do. Medi-Share is the convenience model. We want to make it easy and make it transparent. The second is, when we do that, we want the provider to get paid quickly. Sometimes in the healthcare sharing world, different organizations have different methodologies. We believe 30 days or less, 90% of our bills should be paid, and that's what we do. We actually pay 60% of our bills in 3 days. They come in and we have the technology to do that. So direct bill and quick share, really, really important to how we do it. Of course, no matter what you do, if people aren't satisfied with it, then it doesn't matter. So we've polled our members, hundreds of thousands across the country over time, and they give us a 98% customer satisfaction rate. Not our voice, that's our members' voice, and we're very appreciative of that. And then the final, again, remaining aligned to our vision and mission, that is, we are aligned with your values. Our members consistently say part of the reason they join or they got interested in Medi-Share is they wanted to know that the dollars they paid in were shared to things that they were aligned with and not shared with things that were out of alignment with their biblical worldview. And so we're really proud to be able to have that as part of who we are and what we do. And one thing that people sometimes don't realize is that we have member voted guidelines. So our members actually vote on any guideline changes, and it has to be approved by a certain majority of the membership. So we're very member centric and thankful for the way the members come around the community. John, I think we have one more, and I'm going to invite you to speak into this. I'll just simply lead in to say, you know, the word unique, we all use unique in so many ways, but I will say this is one of the pieces, and John spoke into the prayer aspect, but our community and the way they come around people when they're sharing dollars that they've paid into the ministry get shared to other members for a need that happened, a medical bill that happened that needed shared. And John, I know you have a couple comments on this. I'd invite you to share with the audience.
Yeah, thanks. You know, Mark, so much of our experience, I would say, as Americans, just in general, we live a very transactional life. You know, we go to the grocery store, we give money, we get food. We go to a restaurant, we give money, we get food. So much of what we do is purely transactional. And I think part of what makes the Big C Church so transcendent is it allows individuals to step past transactional lifestyles into connected community. And so we've seen that obviously in the weekend gathering of the church, and you get to see your brothers and sisters in Christ, and that's excellent. But being able to take that community experience and put it into something that has been so transactional, like health benefits, is absolutely incredible. So what does this community look like in my own personal experience? So obviously I mentioned the prayer side of things, and that was very early on as being a Medi-Share member. I then remember getting an email, and the same sort of thing as phone calls from your health benefits, is looking through your email, sorting through like, what is this? And something caught my eye when I had either logged into the portal. I think it was an email alert. I was like, this is not just a marketing email. This is personalized to me. And so I started reading through, and I realized my monthly share dollars were being tracked directly to where they were being shared and to whom and what it was kind of helping for. Obviously, there's all the, they keep things anonymous in a way that keeps it compliant and everything. But like, I was seeing with my own eyes that I was not in a transactional relationship with my health benefit, but I was actually contributing into a community experience of believers. And so I was able to then get excited about that every month. When I would see the report, I realized what this was. I was new. And it's incredible to know I'm not just going and buying something and getting something, but I'm actually being part of enhancing people's faith journey, their well-being, for my brothers and sisters in Christ. So anyway, thanks for letting me share that.
No,
I'm very passionate about this.
No, I know you are, and I love it. And it never gets old to hear that. So I appreciate you sharing that. And for the audience benefit, you see a lot of slides these days. You all can consume webinars every minute of your living life if you would like. And so we're appreciative that you chose to spend some time with John and I today and Rich. But one of the things that sometimes you see is really nice slides and they look nice, but are they real? And I just want to point out, if you're looking at this slide right now here on the webinar, you see 101 members just shared your need. This is actually a live screenshot from one of my team members who had cancer, and he's on Medi-Share. And these are screenshots, this third one from his phone. Wow. And so it's real, and there is a community, as John so eloquently said. Thanks, John.
Wow. Yeah, thank you, Mark. It's great. All right, Mark, I want to transition. Hopefully this gave a good overview of not only what Medi-Share is doing, but why Medi-Share continues to do what it does. It also will answer the question of why is Medi-Share continuing to grow so much. I think we've answered all of that. Now let's talk about some of the contentions. This is where I have fun, because I like it when you identify a problem and you find out, is there a solution or not? Is what I'm thinking actually true, or are there alternative, perspectives? And so let's talk about the biggest reasons why groups haven't changed yet. And I have yet, because I know there's some of you on right now that I guarantee it. I've done these enough. We're going to mention some things that you haven't moved over to Medi-Share, for your whole group because of some of these things. So, Mark, let's talk about some of the things that you hear. You're at the front lines and chatting with groups that are saying, "Oh, but this." What are some of those big contentions?
Yeah, happy to. 3 things that I'll throw up for the group. The first would be pre-existing conditions. That's something that comes up in conversations on a semi-regular basis. And for the audience, a pre-existing condition would be a condition that you had prior to entering into membership with Medi-Share in the last 3 years. And I'll give you a very tangible example. Someone had cancer a year ago, and so they come to sign up for Medi-Share. The first thing that's misunderstood is that they could not join Medi-Share because of that. That's wrong. They could join Medi-Share if they sign the statement of faith and they're a non-smoker. Anyone can join Medi-Share. However, we will do a review of their information. We see cancer. We're then going to reach out to that individual and have a conversation and say, you can come into membership. There will be a waiting period for pre-existing condition, i.e. the cancer. Any needs that come up during that waiting period would be their responsibility. But, all these other items would be shareable. Our word shareable for the insurance industry's word covered. Okay. So interesting fact, we have those conversations with people on a regular basis every day. 11% of the people, we track it very closely, 11% of those people end up still joining. So pre-existing conditions, people just mentally go, oh, I may not qualify, but we need to have a conversation, and that's what we encourage people to do. So that's pre-existing conditions. The second would be preventative. So routine medical visits, doctor visits with your kids, immunizations, etc. Those items usually fall below the annual household portion, which is your deductible, like your deductible. And so anyway, at Medi-Share, we say we take care of the things above the line, above your annual household portion, and you take care of the things below it. And so one of the things, and John, I know you will chat briefly about this, that our partnership with Remodel brings is in the group space. We're able to bring preventative in for those who are interested in having that as part of their overall group plan. But that does come up. I will end on this note by saying we just had a member speak to our ELT team just last week. And we asked them about preventative, because occasionally it comes up and they said, oh, well, no, the savings that we are getting from being with Medi-Share, we take some of those savings and we actually do additional tests through some of the partnerships that you have with physicals, et cetera. And we feel we probably wouldn't have done that if we were on traditional insurance. So everyone's different, but that's how our system works. And then the final,
I love that.
And then the final item is fit. So we are hawkish about fit. We do not believe Medi-Share is perfect for everyone. I don't know that there's a health insurance product out there that's perfect for everyone. We don't try and force people into it, but we serve a lot of people, and we're able to help the majority of people that inquire and reach out and have a conversation. And so one of the big reasons groups sometimes say, hey, I'm not sure. We have 20 people, we have 10 people, we have 50 people, but this person may have a medical condition. That's fine. Medi-Share can handle these. And as John has shared, one of the reasons we partner with Remodel Health is to bring options to the table to serve everyone and meet them where they're at. So sometimes people allow fit and not having the knowledge they need to stop them from moving forward. Those are really the big three, John, that we hear in regular conversation.
That resonates with me. Obviously, I'm having conversations with groups as well, but I like to hear from you because representing Medi-Share, knowing those top things, to me, I'm hearing a lot of misconceptions, though. And so I really want to encourage all of you who maybe you're starting to hear little things here and there that might be triggering some things. I do see some questions coming in. That's great. We will get to them at the end of this. Don't leave your misconception in control. At least start looking into, can this be a good fit? Are the things you've always disqualified yourself actually worth not looking into? I'd say that you need to do something about it today. So I'm gonna move into a hey, go ahead. I see we've been joined by Mr. Rich here. What's up?
I don't want to jump in early. I thought we were going to questions. I don't want to jump in early. I'm just taking notes here. I'll keep taking notes.
That's great. I think I literally have a slide that says questions with a question mark, and so that'll be your cue. Thank you, Rich. We are very well prepared. You can tell. So Mark, we've talked about kind of my story of empathizing with health benefits, particularly in the church space. We've talked about the big problem that's been happening in health benefits, and then how, these problems, necessity is the mother of inventions. And now we've seen this innovation, and then we've seen Medi-Share, another incredible innovation, then blend right in with what's happening in the industry. And we've talked about the contentions. Now it's time to talk about how this all pieces itself together. And this is where Remodel Health's partnership with Medi-Share and the strategic alliance we formed is so powerful. Okay, so here's the basic idea. Obviously, we're not doing a group plan. These are individual products that we're helping people to get on their health benefits, but we're going to manage it all together so it still feels easy and simple like a group. Okay. And the way that it works is this: the employer will create a Medi-Share benchmark saying, hey, we want you to get on Medi-Share. It's an incredible fit. It's an incredible tool for our organization to care well for you and to have it be something we believe in. It's part of a community. Each of those employees then can get onto an individual plan that matches. Okay. There's a lot more details. Not going to go into it right now. But here are the way that the pathways can work. Okay, we talked about the pre-existing conditions, and first, to not write yourself off. There's a lot of people that we're gonna just self opt out, and they shouldn't have, because it wasn't actually a pre-existing condition. But we do know that in our communities, there are people that have acute care that's needed. And those people need to make sure and get that care. And sometimes it's just not a good fit for them. but it no longer disqualifies your entire group from taking advantage of Medi-Share as a community product. And so what we can do, we can send a bunch of people over to Medi-Share, get them onto individual health benefits, and then get your person that has an acute need, maybe it's even you, but maybe someone you know, and get them onto an actual insurance plan that will just take care of them where they're at the way they need. But then also, I want to just make sure and let y'all know, I've seen this happen a lot. There's people that actually would qualify for Medicare, and getting them onto Medicare can be an incredible thing. They didn't know it. We can do all of this. And honestly, there's even more layers to this. But the big idea is Medi-Share can fit so well for so many. Don't write your whole group off for the sake of just one or two individuals. We can care for all of them. So we've already kind of talked about some of the benefits of Medi-Share, but then as powered by Remodel Health, obviously Medi-Share bringing that national PPO network. We all love those PPOs, do we not? But then also something very interesting. I'm just giving you teasers. I'm not going to go into the details until maybe the questions, but HSA eligibility alongside Medi-Share. And yes, you heard me right. It does not make Medi-Share HSA eligible, but we can bring alongside eligibility, okay? Preventative care, we can bring that alongside Medi-Share, continuing to enhance the benefits package you're offering to your team. Ultimately, we're talking about lower out-of-pocket costs. Lower cost for health benefits, not only just the actual product that's kind of helping keep you safe, but also how much you're spending when you go to the doctor, when you go to that procedure, those sorts of things. So we've got software, we've got a full care team. We just, really, really great telehealth. We've got extra ancillaries available if you want to look at it, payroll deduct. I'm going to stop going through the whole entire sales pitch. I do like people to know about telehealth really, really quick. I mentioned that I love technology. I love my phone. I love doing stuff quick and easy. You do get, hey, Mark, just explain the telehealth stuff, because I don't want to get it wrong. I know it's great, but I don't want to say something. Talk about Medi-Share and the telehealth that y'all got included for all y'all's members.
Sure. 24/7. Board certified physicians, average phone call with a board certified physician, over thousands of telehealth visits just in the last year, 12 to 15 minutes. And from there, prescription gets called in, or they get diagnosed, or they say, hey, you need to do X, and our members love it. And it's part of the Medi-Share membership. So really, really easy.
I love that. And, I think we all got accustomed to things, whether it's Zoom, like with this webinar. A lot of people, I actually looked at the stats. People want telehealth. You get telehealth with Medi-Share. Wanted to make sure you knew that. I'm going to talk about medical dollars, preventative coverage. Only about 8% of people actually use preventative. I want to see that number go up. Sometimes people will not go to Medi-Share because they want preventative and they aren't even using it. So if you do move forward with us, we will make sure you use your preventative and you don't lose it. We're going to bring it alongside there. Here's something else I want to make sure and inspire you on. I'm just kind of stirring the pot at this point, okay? Is that you can not only save money for the organization, you need to turn those dollars into medical dollars for your team. And what I mean is, don't just get them onto a product, okay? Don't just get them onto Medi-Share. Also, take some of your huge, substantial savings. Please give them dollars so that when they go to the doctor, they're not having to pay out of their own pocket. It comes from the money that you just saved. And honestly, when I'm talking about the $68 million that Remodel Health and Medi-Share, it's combined in this model, that means people actually are getting better benefits, getting medical dollars, okay? You've got to make sure and do that for your team. Here's a breakdown for those of you guys that like to see side-by-sides. this is just a really, really great real life example of managed individual with sharing versus traditional group. I mean, substantial savings. And I don't know, Rich, if you were able to, can you switch our screen, our cameras over to the left side? I don't know if that's you or if it's, oh, there you go. Thank you. There's 0 savings on the left column. And then you can see this is a group, incredible savings. Instead of, spending $350,000, they're now spending $204,000. That's 20 employees. I'm going to tell you right now, before we get into the questions, this can go all the way down to around, 5, all the way up to 500 and more. Okay. The only reason it starts at about 5 is you want there to be kind of, critical mass when it comes to your, your savings and all that. But man, the sky's the limit as well, and everybody in between. So I'm going to ask the same question again. Do you want more or less in your budget, better benefits, 68 million saved, just using this particular model? Obviously, Medi-Share has been around for a real long time, helping get money back into ministry a lot. And so this is the first step, is running a quote, okay? You don't have to sign up. That would be silly of me and Mark to try to be like, buy now, because we don't even know who you are. We don't know your team. We haven't seen anything. We don't know what you're spending. We don't know if it's a fit, like Mark said. But you do need to do something about this. I saw one of the questions. I'm going to answer this right now. No, there's no deadline for when you can make this sort of switch in the year. Okay, so I want you to hear me loud and clear. I know we're in the middle of Christmas season. Put some time on the calendar for January. Okay, that's okay. But you need to get to this sooner than later, because if you're going to save hundreds of thousands of dollars, the longer you wait, the more you're losing in what you could have been saving. And so this is a busy slide. You're going to catch something. You can text. You can go to the landing page. My personal email, Mark, I'm hearing you're getting a personal email. So this is my personal email up top. This is my favorite thing that you could do for me. Just email me. You can email me questions, or you can email me saying you want a quote. If anyone through this webinar that runs a quote, I'll give you a $100 Amazon gift card. Okay, that's going to be my commitment to you if you end up running through our analysis. My goal is that you get to see what you're doing alongside what you can do with Medi-Share powered by Remodel Health. See what kind of impact you can make on your ministry. Maybe you're in a tough spot. Okay. And things aren't looking great, or maybe you're in an amazing spot. And if you add more resources to your church, you can just take off even more in 2022. Either side, you got to do something right now, right here today. And I'll even thank you for it. I'll give you an Amazon gift card, because I'm a really generous guy. So here's the question slide that Mr. Rich was waiting for. And let's get into some questions now.
Love it. Great. Lots of great questions. A number kind of clustered around the grouped situation. You've answered some of these, but we'll kind of cluster them together. Is there an additional cost, like administrative cost? Is it better for people to come as individuals or as a group together? How does it work? Are they actually saving? If they say, that average kind of church of maybe 5 to 10 staff, is it better, or should they just be pointing people, hey, why don't you just all go individual? There's a number of questions.
Yeah, I'll answer that. My perspective is this: having been on staff, you want to feel cared for by your church, by your leadership.
Yep.
And to simply say, hey, you're on your own, go do something by yourself. If you need to, I understand. I can empathize with that. I've sat in those meetings. But that doesn't necessarily make me feel more cared for. Nationally, 56% of employees will make their decision whether to stay or leave their job based on health benefits. So health benefits is actually more important than pay. And so if you right now are doing something like a traditional group, you're definitely going to save money doing it as a group. And I would encourage you to at least look into that first before you send your people off by themselves. That can be scary by themselves. They need help, not just money. So those are my answers.
Great, kind of similar follow-up question around just this kind of scope and size of the group business at Medi-Share? Like, how many churches or organizations are doing this as a group? What does that look like? And then Frank asked a good question. He's like, hey, can I get some names of churches I could talk to? I think Frank needs to talk to you guys because he's got some really good questions. But are there any churches I could talk to, that we could just get some references from?
Mark, you guys have been in this for a long time. Talk about all the churches that you guys serve.
Yeah. We've been doing the actual sort of group side. We call it the employer program side here at Medi-Share for, I'd say, 3 to 4 years. We have 750 churches and or faith-based nonprofits in the ranks today. And I will let you know, we've been partnered now with Remodel Health for a little while. The size of groups that we're able to serve. And as we're building that, we're just really excited about it. Frank, his follow-up question is, hey, can I get a referral? Sure. We have combined referrals with Remodel Health. We have referrals where it was just Medi-Share only, usually, smaller groups. So if you have a group of, 2 to 4, and we have some groups that are above 5 that are just on Medi-Share, but we're happy to help.
That's cool.
Yeah, I agree with everything Mark said. I will tell you, if you want a referral, we're going to wait till after Christmas because all these pastors are getting ready for their Christmas services right now. I've been there. This is crazy time right now if you're working in the church. So.
Yeah, this is a great question. Let's say we've got maybe a bit of a bigger group, 10, 15 people. Do you guys do information sessions for the churches to kind of help in the transition? Because there are some nuances, right? This is a little different than like you say, traditional insurance. What does that look like on kind of helping introduce this solution?
Yeah, absolutely. As you can see, the way that both myself and Mark are carrying this message, we are education first because this is a change in the way we have thought about health benefits in the past. You as a leader know about change management, change leadership, and we want to lead people well through change because change can be scary, especially with health benefits. So absolutely. There's not even just one meeting. There are multiple personal touch points with your people. So not only do they know what's happening with you, but they're able to actually grow as individuals in this space, very complicated space. And we're out there to make experts out of everybody.
This is great. Well, we've come to the top of the hour. We're almost at the top of the hour. So I want to make sure we let folks go. So just a couple kind of housekeeping issues at the end. We want to send people to that link, Medi-Share. Want to make sure you hit up John. Is there like a time limit on that, on the $100 Amazon gift card offer there? Is there one put a cap on that, or you're like, hey, whatever?
Well, so here's the deal. I know that we're all shopping for Christmas right now. So if you make sure and reach out to me right now, even if we don't complete all the steps till January, I'll make sure that you get taken care of and we'll figure it out. Okay.
That's great.
And Mark will cover for me if I get in trouble or whatever. So
I'll cover.
Thanks.
Well, it's great. Friends that are listening in, and I've said this in other contexts, about these solutions. I really do think you should look at them. I know there's a lot of leaders who are listening in who are responsible for this part of what they do. And I think you'd be doing a disservice by not at least looking into it, at least doing the research and at least deciding against it. Don't just let it filter by and hey, that's something I don't want to think about. Reach out to John, reach out to Mark, get your questions answered. I appreciate you guys being here today. Thank you so much for your time. We thank you for everyone who's been listening in. Any parting words as we close out today?
No, just really grateful to be able to help people learn.
Great.
Yeah, likewise, Rich. And I just emphasize to the audience, if I pull together the number of people that have told me they waited longer than they should have once they came to Medi-Share, it would be a staggering number to your audience coast to coast. So I just encourage you to dip your toe in and the rest of the story from today. But thanks for the opportunity. Love being with you all.
Thanks so much, friends. Have a great day and enjoy Christmas. Hopefully you get some downtime as well over this season. We'll talk to you later. Take care, friends.